most importantly talks about requiring insurance companies to disclose how they do medical management, which is the way that they really prohibit people from gaining access to care for mental health and addiction services. So, very powerful platform statement. In addition to that, we know of her work throughout her public life. It's always been about families and early intervention and prevention, and that's the model we need for our country.
What candidate do you think most lines up with your views?
Well, I obviously am a big enthusiastic supporter of Hillary Clinton for president. She has, for her whole life, been fighting on behalf of people who've been dispossessed, and she's been fighting on behalf of families, and mental health has always been something that she's fought for. If we had implemented the health care plan that she constructed, we would have a different day in America today. We wouldn't be talking about these issues. Her plan for health care had parity embedded in it, and if it had passed, we would have been a decade ahead of ourselves in terms of implementation. We would not be where we are today if Hillary's plan for mental health had gone forward, a decade ago.
And I guess that
look at how far we've come with gay rights. A decade ago, I voted against the Defense of Marriage Act. These days, that wouldn't have been any big deal. Back then, it was a big deal because, that was still the atmosphere that, gay rights were not, accepted. And look at what has happened in the last couple of years. We finally come around to embrace our brothers and sisters with a different sexual orientation. Look at what happened with AIDS. We had a crisis. Everybody was afraid to talk about it. Today, HIV/AIDS is a totally treatable illness. And I think these are examples of where we can make progress. And we've got to overcome the same barriers of prejudice and bigotry towards the mentally ill and those with addiction that were overcome against people who are of color and people who have different sexual orientation. This is a common cause, and that is treating people with dignity and respect.
Some even tasing we mentioned as a possible thing. What's it mean for a nice peaceful protest like this?
Well, you're covering it, thankfully. We just have to keep on, whether we get coverage or not. We have to be organized and move forward. Not everything is going to gain the headlines, but we need to make progress nonetheless. And as a community, this was very helpful for us today. We had all the major mental health groups sign on in support of this rally and sign on behalf of a united agenda for mental health and addiction. That's really never been done before. And so we're setting a model for future conventions, too.
There's a woman who walks around, Patrick. I don't know if you've seen her with the casket. What's your take on that?
I love her passion. She is really doing what she can to raise the alarm of these tragedies of overdoses that are affecting her community. And it's symbolized in the number of people who have died, and she's carrying a coffin to illustrate that this is a real issue. She's got the names of the people who've died of an overdose on that coffin that she knows personally. I have enormous respect for her and what she's doing to raise awareness about how fatal this illness is and what the epidemic of this illness is.
And you endorsed Hillary Clinton. I'm curious